Welcome to Inside the Plastic Bubble with Dr. Burton Sundin and Cissy Christopher. This is part 2 of episode 1, in which we discuss radiofrequency microneedling, fillers, deep plane facelifting, and cool sculpting. We hope you enjoy. Let's talk about things that work and things that don't work. We talk about tummy tucks. Those really work. Liposuction really works.
Liposuction really works. The Infini really works.
It does.
For a non-surgical procedure.
You've had Infini.
I've had Infini, yep, and it really does work.
Love Infini. Infini's radio frequency microneedling. Yeah. We have a little more extensive formal discussion of this with my brother, but the little small needles go into the skin, deliver pulse energy. Sounds horrible. When you describe it, like it doesn't hurt that bad. It's not that bad. We do have a way of getting you numb, but it will really, if you're not going to have facelift, that radio frequency microneedling technology is where you want to go. And this is another thing. I'm coming back to the marketing. I'm going to go a little bit this little inside the plastic bubble moment. Okay, there are about 10 devices that use the same technology, and a lot of them have a lot of stuff on Instagram. Kim Kardashian just got the Morpheus 8, and that's like all the buzz. But and I'm not. It's not. I'm saying, I don't have Morpheus 8, so I'm telling you, I don't recommend it. But I have had 10 years experience with this Infini Genius device, and I have really fine-tuned it. And there's certain advantages to that I believe in strongly, anecdotally in my practice. And I think it's great that Kim got that procedure, but don't be fooled. People are paid for this kind of stuff, and don't you think? Like, what are your thoughts on all that?
No, I agree. The way that I look at it, being here, I've been here 9 years.
Yeah.
When I first got here, you guys had some stuff.
9 years.
I know.
9 years of bliss. That's right.
Exactly. But when I first got here, you guys had some stuff that we actually don't use anymore.
Right.
And so I tell people that if we don't have whatever thing that you're looking for, it's because it doesn't work.
Yes.
Or it doesn't work well enough yet.
Yeah. I'll tell you, there's lots of things we've used. Like, we were really big proponents of oil therapy, and that was the best thing at the time, about 7 years ago. But we abandoned that for the RF microneedling with the Infini Genius because it just didn't work. I mean, the oil therapy hurt. It was a pain. But there are learning curves where we have different things come out.
Right.
And we don't. And another example of that is thread lifts. Oh my gosh, thread lifts. You get a lot of interest in thread lifts because it looks so cool on Instagram, people getting their face sort of swept up. But what they don't tell you, and we had our experience with this, we used the PDO threads for a while, and those things, people get nodules, they complain of pain, they're just, it's just like a kind of a pain, right?
Right.
So we never really had a lot of good experience with those things. The silhouette threads are okay. I think you had a silhouette thread too.
I did about
You are a treasure. You're a walking treasure trove. That's right. She could tell you about almost everything. We don't do everything to Cissy.
No,
only
I
the
volunteer.
Finest. Only the finest for you.
I volunteer.
Only the top shelf.
And then I say, is it going to hurt? Because that's my thing.
She likes to have some medication too. So
I do.
Good.
I enjoy the Valium.
Okay. So anyway, silhouette threads are okay, but they really don't provide longevity. They're kind of a hassle, and they're expensive. So I try to steer people towards the Infini.
Yeah.
I try to get them to do fillers and Botox because these are things are really trying to. And the filler technology is amazing right now.
It is. I was going to say that. It's
new brands of fillers. We love this RHA teoxane
and it's
stuff.
Subtle. But it makes a difference. I mean, plastic surgery, for the most part, should be subtle. Like, you should be able to look and say, well, she didn't look like she has anything done, but that's, that's...
we got to save some stuff for other upcoming shows, but we can talk about different kinds of fillers. Yeah, fillers and Botox, another thing. But that's a good little discussion. Okay, but anyway, so... we talked a lot about, we did some segments with Cissy because she's actually going to do a facelift with us again.
Yes.
She had a facelift. How many years ago?
14.
14
Yeah, I
years.
was 48.
Yeah, but sometimes, facelift is really designed to last a long time, have good longevity. But sometimes people do need a little follow-up procedure just depending if they did get into it earlier. And there are indications to do it earlier. But a lot of time now we try. Back then they didn't really have things where we kind of bridge you, so that was kind of like
right.
How to have things to nail and you have a hammer, but So, I was just going to talk a little bit, and we did a little more technical discussion on this with Dr. Reps, but about what is this? This is this crazed discussion of deep plane facelifting. Have you seen it?
Yes,
seen
I have.
Right?
Yeah.
And I mean, this is no denigration of the doctors that are promoting this. And it's a surgical technique. It really, all facelifts address the deep plane. Modern facelifts, at least if you've studied it correctly and you've worked with some of the people that are like the gurus of facelift and neck lifting, we're going to address the deep layers. The neck is the layer we address is the platysma, and the face, it's called the SMAS. And we're not going to just address the skin because it doesn't last.
Right.
But, and we always are working in the deep plane, and what we do is sort of a modern amalgamation where we address the face by either taking some tissue out or plicating it and getting the deep plane that way. And in the neck, we lift up this layer of platysma and really pull it back in a good way to kind of define the jawline.
Right.
And yeah, I mean, one day I see myself getting this procedure. I'm getting old, 52. I gotta go find somebody who can. Anyway, but I am a baby in essence. That's not that old. But back to that. But the newer perturbations of deep plane facelifting. And by the way, all this stuff has been around forever. Ever since the 70s, people have been talking about different ways to do a facelift. The mini lift, the micro lift, was very popular in the 1990s, early 2000s, and now people are doing sort of modern techniques with skin and deep layers. But just to shed a little insight to sort of again the inside the plastic bubble moment for you, or the Asher Cissy, some going too far in these deep planes can be dangerous. You are prolonging the surgery time, doing unnecessary dissection, getting close to the nerves that are very fine, kind of down. As you get past this sort of drop line in the face, you're getting close to the smaller branches of the facial nerve, which can recover, but that can cause people facial nerve injury, irritation, and kudos to those people doing that. But I don't know how much benefit we're really getting from that. I really don't advocate it. Extra time in surgery, extra risk, always something for minimal difference in result. And also, I think some people getting these things are like way too young. Getting if these most aggressive facelifting procedures at a very young age is kind of a strange concept too. So anyway, kind of we'll have some more commentary on that. And with Cissy, we're going to address the deep layer and the platysma in the neck. Oh, so speaking of things I think work again, okay, cool sculpting, okay.
Yes. Oh,
now, some people say, there are people that say that it doesn't work. I can tell you, we were one of the first people to ever use cool sculpting, okay. Cissy can attest to that.
I'm like,
what do you think about cool sculpting?
Well, before I got here, I'll be honest with you, it was right when it first came out, and where I was working, they did not have cool sculpting. So if someone would call, I did not know any better, and I'm like, I don't think that works. You really probably do need to have liposuction. So when I got here, we had it. I tried it, and it does work. It is. I have. I did my upper abdomen. I did it. It's been 9 years because
gone.
I did, and it's still. I still can't. I can't pinch it to do it a second time or to do it again. So it really does work.
We've used it since it was ever invented. Now we have the most advanced perturbation of it, the Cool Sculpting Elite.
Right.
And I'll tell you, I did it yesterday.
I know, it's not a secret. I saw it.
Oh yeah, I was putting it on Instagram. I was trying to be cute. Anyway, I did it yesterday.
I seen it.
It's a little uncomfortable at points. It's not. It's not a pain-free procedure, but it's totally easy to do. Actually, the great thing about the newer machines, they can hook you up at multiple sites at one time. So in an hour, I had like 4 treatment sites done. It was insane.
Although the old way, you could binge watch a show, so it wasn't bad either.
Yeah, that was cool too. But we did the cool sculpting on me. I'm a little sore and swollen today, but it's great, And I actually did it back when we had the earlier device, but it's not. The fat loss stays gone, but you can certainly gain a little bit more back in areas, especially as you age. I mean, I think I haven't done it for 10 years. Yeah. And now I'm here redoing it again, but my results stay present. If you really are interested in not having surgery, I always tell you, surgery is the best bang for the buck, right?
However, if if you can't do it, if you don't have the time available, you just can't do it right now.
Yeah.
Cool sculpting, it's still a permanent fat cell loss. Your body doesn't make new fat cells. They don't migrate back to a treated area, so it's something that you can do.
So yeah, I had the cool sculpting yesterday, right? And it was a little uncomfortable, not that bad, but I tell you what was crazy was we used the massaging device to massage afterwards, and it breaks up the fat crystals and everything like that. On my flank, it was insanely ticklish. I could not, I was like howling in laughter when they were doing, it was a little uncomfortable, I'm not gonna say it was ticklish, but like honestly, like it was, I think we got some footage of it, so maybe they're gonna work that in. If they're showing that right now, then that's why I'm looking like I'm like being tickled to death.
Tortured,
tickle torture, exactly.
Yeah, that's what tickling is.
Yeah, I think, so it's tried and true, and we tried tons of other non-invasive fat reduction machines. They didn't work. We tried the Ultra Shape, True Sculpt, I mean, you name it, we had it. A Liposonics, that one really hurt. People did not like that one.
We tried to turn that one machine to a snow cone maker, but it didn't work. So.
We're going to have to put a face on it. We're going to have an Office Space moment on the Ultra Shape. Like, take it out back and like beat it up. Yeah,
exactly.
That was a waste of time. We had a lot of people do it, but
and we gave them cool sculpting.
Yeah, we had to treat them with some cool sculpting, but. Anyway, Ultra Shape is something that's kind of gone out of the favor. I mean, it worked a little bit, but it just wasn't, it worked fairly well, but we would normally have to back it up with some cool sculpting.
Right, yes.
Okay, so cool. So those are some things you know about my cool sculpting yesterday.
Yep.
Yeah, we're talking about TV shows, right? We can watch TV shows while we do cool sculpting.
Yep.
What's your favorite TV show now? What are you watching?
Well, my favorite is Severance.
Oh yeah,
I'm actually
Severance
rewatching.
Is kind of dark. I've watched
Severance.
it with you.
It's quirky.
It's funny though.
Yeah, it's very funny. It is. I'm enjoying it.
The innies and the outies.
I know, exactly.
That's what we can talk about with tummy tucks, right?
Exactly.
How we sometimes with a tummy tuck, sometimes we make a tummy tuck and the patient has an outie and we make it an innie. So,
but we're thinking as far as a facelift goes, that my outie is going to look more like my innie.
Yeah, your outie.
As my innie feels.
The innie and outie on Severance is like, the in-office personality versus the out-of-office personality.
Right.
But anyway, we joke about that all the time.
Yeah.
So.
And it has a guy named Bert on it.
That's right. There's a character named Bert.
Exactly.
My name.
Christopher
That's right. Yeah, we're gonna get your outie looking like your innie.
Okay. Like my innie feels.
That's cool. So. All right. Well, anyway, so the Kardashians. Do you watch the Kardashians?
I don't.
Yeah, you don't.
I've never been on.
I used to watch them, but they kind of get annoying,
Yeah.
But some of the reels that you can make with Kardashian voices are kind of funny now.
Yeah. True. I used to watch. What is it? Remember
there's the one with like Kanye. He's like, "Can you believe we don't have a jacuzzi?"
We don't have a jacuzzi.
Can you believe that? Can you believe we don't have a jacuzzi?
That's my favorite one. She says, "I can't believe we don't have a jacuzzi." He's like, "Can you believe we don't have a jacuzzi? But we have Morpheus 8 in our basement." I just bought this Morpheus 8. I'm treating myself with it every day. They gave it to me for free. No, they didn't. That's Morpheus 8 people do not come after me.
They're a mess.
They did not, and Kim Kardashian, please don't come after me. Am I running out of cue cards? I might. It might have to just be spontaneous. This might be the end of the segment.
Okay. All right.
Blank. That's it. I have a little cue card so I know what I'm doing. But anyways.
Right.
Okay, cool.
Okay.
Well, I think we had some fun in discussing things. Inside the plastic bubble and Ask Your Sissy. We're going to be putting some of this on Instagram. Again, my goal is to give you, hopefully, some information that demystifies this whole thing for you, that brings you the accurate and true information about plastic surgery procedures and aesthetic procedures without all the hype around them. So, we live in an age of influencers, so you need to have the right information to make the right decision. These things are important decisions. And you can send Cissy some messages at Ask Your Sissy too. She'll answer your questions as well.
I will. I'll be
happy. I think that's your
to.
goal, right?
It is to like you said, to inform people, and that way you can make a good decision with it. No one, especially I hate for anybody to have a bad plastic surgery experience because it affects all of us.
Yeah.
And so
we want people to have a good experience. We want people to become. We want to be your friend here and have you come in and enjoy it.
And we have lots of patients that feel that way.
Have some laughs with us, but also take it very seriously.
Exactly.
Well, anyway, if you want to come and meet us in person too, you can. Just make a consultation. We'd love to see you. And thanks for being with us today.
Thanks.
Thank you for watching Inside the Plastic Bubble. If you like our content, please be sure to like and subscribe to our YouTube channel.